With over 100 primary health care centers built and equipped to function at maximum ability across the state, primary health care service is a major focus of Governor Darius Ishaku-led administration. On the program this week, our focus is on primary health care delivery as driven by Governor Darius Ishaku. My name is Nelson Etta. Join me as we discover health in Taraba.
At this coronation of Gradunga are prominent sons and daughters of Taraba's South Territorial District who spread across political and religious divides. Also in attendance is an elder statesman, General Theophilus Yakubu Danjuma retired, the Gamboro of Donga, captains of industries, among others. Governor Darius Ishaku here tasked the Nogara Donga, Sangula Zimburu, to continue the enduring legacies of his predecessor, Stephen Buyanga, who worked for the overall interest of his people. He stated that his administration will always rely on counsel from traditional rulers, which is why they should stop seizing lands from their subjects. He wants them instead to work with the government to surmount security problems in the land, to uphold peace and unity, and carry everyone in their domain along, irrespective of tribe and religion.
I employ all the traditional chiefs to uphold peace and unity in their various domains by treating every Nigerian equally, regardless of their ethnicity or religious affiliation. We must take advantage of our diversity in order to create a strong, unified and indivisible Taraba state.
Today is also a day of celebration because Donga Chiefdom is rightfully blessed with a new king with impeccable track record of service. He is highly educated, a civil administrator and diplomat who has traveled widely, and a peacemaker too.
The installation featured administration of oath of office by the Chief Judge of the State, Philibus and Deto, and was accompanied by the presentation of royal gifts to the Gwanwari Danye Ademo Umar Sanda on behalf of the Chamba Nation and traditional dancers. The new Gwara Donga Samvala Simbura is a 10th and bears the title of Gwanwayi II. The presentation of staff of office to Manu Ishaku Adale, the Akuka by Governor Darius Ishaku, was a colorful occasion attended by traditional rulers across the country, including the Sultan of Sokoto. The Governor of Plateau State and Benue State, among others, also attended the occasion. The elder statesman, Tiwa Ndajima, used the forum to speak about the security challenges bedeviling the nation. He expressed disappointment at the reactions of the military authority to his earlier warning that the bandits were planning to take over Nigeria.
The whole country now is being run and overrun. And one very clear thing that is happening is that these foreign invaders, they are not even Muslims. A lot of the casualties inflicted on the land are on Muslims. They are destroying even mosques, but they were allowed to come into the country by our government.
And to this phenomenon, General Danjuma has a solution, and that is for the citizen to follow the same way the oppressors got arms to defend themselves.
You must then unite our people. A lot of the attacks that I got was from our people. They said I told them to defend themselves. I didn't give them arms. I will not give you arms.
Governor Darius Ishaku, on his part, urges the new monarch to be a rallying point for his subjects.
As a retired technocrat who has paid his dues in civil service, his wealth of experience will no doubt come in handy in this delicate relationship between tradition and the inevitable trend of change.
His Majesty Manu Ishaku Ada Ali is now the supreme and the spiritual leader of the Jukum and comes from the Bama ruling house. He is succeeding Dr. Shekarau Angui Master EB, who passed away on the January 14th, 2022.
Dr. Aminu Hassan, a Harvard-trained medical doctor and basic healthcare practitioner, is the Executive Secretary of Taraba State Primary Healthcare Development Agency. He speaks with Discover Taraba on government's efforts aimed at developing primary healthcare in the state. Talking to you, I see that you're a man who is very adept and very passionate about primary healthcare. Let's begin this conversation from there.
Yeah.
Tell me exactly what is your personal drive in PHC?
Well, primary healthcare, let me just start by saying, even from the onset, basic healthcare service scheme of blessed memory of the then Professor Olukoya Ramson Kuti, who is the driver of that process, based on the Alma Ata Declaration. I am indeed part and parcel of that initiative because I participated from onset as far back as 1984 when I was a student in the College of Health Technology. Since then, I've not rested my hours. I've been in the process of ensuring that primary healthcare is properly repositioned and sees the light of the day, up to the level of transformation of primary care from basic health service scheme to primary healthcare, which was piloted in some states, which include the then Gongola state, Mayabalwa in particular, one of the local governments. I've been part and parcel of that adventure to the extent of even transferring primary healthcare to the local government. Because before now, primary healthcare was under the purview and control of state governments. That was then. Not until when it was realized that primary care is supposed to be the statutory responsibility of local governments. That was when a law was passed and then primary care was subsequently transferred to the local government. We are the first batch of health workers in 1987 that were transferred to the local government.
When you talk about that, the PHC had been returned to the local government. Of course, that's where it should be.
Yeah.
But is that still the case today in government? And are they financially actively involved in funding the PHC? Well,
actually, that is the case. Primary care has been run by local governments. But because of different issues and different reasons, primary health care is not run as it should because of shortage of human resource for health, shortage of funding, shortage of medical equipment, and above all, there is no grips by the local government authorities to understand the rudiments and the workings of primary care as a department that will at least help in changing the mindset and health status of their own people. And that makes primary care to suffer again at the hands of the local government. Hence the reason why, based on the creation of national policy on health that delineated health service delivery into three, that is primary health care, secondary and tertiary. Primary health care is now again being transferred again now to state, but not formally being transferred, but the monitoring, supervision, and above all, monitoring, supervision of primary care is now being saddled to the state government under the office of primary health care executive secretaries or executive chairmen or DGs or PMs as the case may be. But they are working hand in hand with the local government chairmen to ensure that primary health care function effectively and efficiently. The agencies are saddled with responsibilities of monitoring and implementing all primary care policies under the auspices of the State Ministry of Health to ensure that the best is being driven from the services that are supposed to be done at the local government level, not as it were before. And I want to believe that it's a very good thinking, that's a very good decision, because it has helped in changing the narratives of approach as far as primary care is concerned in the whole of the country.
That also brings me to funding. So the state government, of course, is directly involved in funding PHC. Now, but I wanted to ask you, before the government of Darius Ishaku came in on board, what was the funding for PHC in Taraba State like, and where is it today?
Well, before the advent of His Excellency Dr. Darius Ishaku as Executive Governor of Taraba State, funding of primary health care has been handled by local government chairmen. And actually, there is a budgetary allocation for that at the local government level, but it's not something to write home about, because primary health care have actually suffered a lot of neglect by the local governments, considering the fact that if you look at primary care, it's a service outlet. It doesn't generate revenue. It provides services, social services, if I can say, because it's there only to look at the health and well-being of the people. So before the advent of Dr. Darius Ishaku, the truth of the matter is primary health care is at its low level in the state. Well, it is being handled by the local government level, being supported by the state government, but not until the law is created, established through the State House of Assembly, that we have started seeing some changes. I can quote what we call the mixed needs survey, multiple indicator cluster survey, that was carried out by the state government. That multiple cluster indicator survey have highlighted Taraba State to a level of only performance of 16%, which is far, far, far below the national target of 80%. And that is a source of concern to many of us. The health facilities are nothing to write home about. There are not enough infrastructures, human resource for health, there is no training at the training, there are no drugs in most of the health facilities. Immunization, we are far below our performance. You get the point. Not until the agency was established and the subsequent bringing on board of all program officers, directors, and what have you, and then sitting at the driver's seat to provide the leadership. That is when we started seeing and experiencing a lot of changes, coupled with the funding and the enabling environment the state government under the able leadership of His Excellency has given to the agency. We started under a mango tree without even an office. Wow. But today, to God be the glory, we have a befitting office accommodation, we have 7 directorates, we have more than 15 program units, and we are in total control of all the primary health care departments of the state local government areas. We recruit, we hire, we fire, we retire, we promote. All of these are indicators that will help human capital development and above all, help healthcare workers to do their best at their own level. Not only that, we have even gone far through the support of His Excellency to ensure that not all the health facilities, but over 70 to 80% of our primary care facilities in the state are now functional effectively and efficiently 24 hours per day, with complement of medical equipment, drugs, and human resource for health. And that has helped in changing the narratives and the concept of healthcare service delivery by reducing out-of-pocket expenses to the common man in the field, in the local government level.
That, speaking to you now also lets me see the passion, you might say, of His Excellency in the area of health re-strategization in the state. Could you tell me exactly what his vision is for repositioning primary health care in the state?
As I'm speaking to you now, through NSHIP and the support of His Excellency, we have successfully repositioned over 100 primary care centers, fully functional, from the top to below, with full complements of medical equipment, infrastructure, drugs, human resource, laboratory equipments, and what have you. And they are there working 24 hours per day in 8 local government areas of the state.
That's the second area I wanted to actually get into when you talk about partnership and infrastructure development for PHCs. But I ask you straightforward, sir, how many PHCs has His Excellency built since he came into office?
Well, you see, it is not about construction. Before his coming, there are functional primary care centers. And the norm these days is what we call universal health coverage. The approach is 1 PHC per ward. And what we are looking for and what we are after is the functionality of those health facilities, provided they are given what we call the required enabling environment to thrive. And what we require in those health facilities is 1, yes, infrastructure, where there are none, construction will come in. But where there are already existing ones, if they are dilapidated, what we need to do is to upgrade them to standard of 1 PSC per ward. 2, infrastructure. 3, medical equipments. 4, drugs and equipments. 5, the human resource that will work in that health facility. Because it's one thing for you to have functional health facility. If you don't have human resource for health and you don't have equipments or the infrastructure to be kept in that health facility, it's equivalent to you don't have anything. So I am not looking at his coming to the level of construction. Yes, there are some constructions here and there, but what we focused more on is the reactivation of the existing health facilities, you get the point, based on 1 PSC per ward. Because the norm is we want to have 1 functional primary care center in each of the political ward that will work 24 hours per day to serve as a feeder for all the other primary care centers that are within that ward that will use for referral purposes, and that we have been able to achieve through his support, through his counterpart funding, and through support from other partners.
Thank you for speaking.
It's my pleasure. Thank you very much for having me.
Thank you, sir.
You're most welcome.
Taraba State Primary Health Care Development Agency is a vibrant service provider for residents of the state, especially those at the grassroots. Health services rendered by the agency include treatments for malaria, typhoid, and other basic health conditions. Discover Taraba crew paid a visit to one of the health centers in Jalingo. We were received by the head of nursing at the center, Sabo Abendoma.
You're welcome.
Good afternoon.
You're welcome.
Thank you for having us around today.
Yes, happy to meet you.
Thank you. Thank you.
Welcome.
It looks like a very newly renovated health facility. When was this renovated?
This one was done from 2018 to 2020.
Oh, okay.
Yes, it was a program, NC program. We made this one, it's an old structure. We renovated it, and we went ahead to build another new structure, extension. Yes.
Oh, wow. And you've been the consultant nurse?
Yes, since then. Yes.
Where were you before now?
No, I'm a retiree. We were brought back on contract. Yes.
Oh, yeah, I mean, when we spoke to the executive secretary, he actually mentioned that retired nurses were all recalled back into the system.
Yes.
I want to ask you, because from what we're seeing here today, it looks like the place can be crowded with people.
Yes. If we had come very early in the morning, we have met a lot of people here. In fact, when it was raining, there were a lot of people. There was a sensitization program here. And now it is because it is late. Otherwise, we would have met crowd here. And it's one of the most busiest clinics around. Yes.
So you attend to pregnant women?
Yes, pregnant women, children, routine immunization. We admit patients at least for 24 hours. We treat them, and we refer those that are beyond our level here to secondary or tertiary institutions.
Oh.
Yes.
You may take us into.
Yes.
Thank you.
This is the male ward. The male ward.
Hold on, sir.
The former consulting room converted to admission room 2. This is the female ward. You could see patients. The female ward here. See patients on admission. This is our maternity.
Oh, this is where the new creation is taking place.
Yes. See, this was the place we met. Then we did some extension.
It means the governor is taking healthcare very seriously.
Very seriously. In fact, it's because of his effort, because of the care he has. That was why he had to do the counterpart funding for the NC program. So the governor has been open doing as far as health sector is concerned. Yes. Yeah. This is our lab.
Where you carry out the tests, yeah?
This is the new structure we built with the NC fund. This is our ANC, where we do antenatal clinic for pregnant women.
Yes.
This is the ANC home.
Of course, the waiting lounge for
Yes.
ANC patients.
Yes, this is the palpation room.
Could you explain what that means in terms of ANC palpation? What does that mean?
Where the midwife will palpate the
fetus.
pregnancy, to listen to the fetal heartbeat, whether it is breathing well, and then look at the pregnancy, how old is it, and then determine, do some tests. These patients are waiting to see the family planning in charge. Some are waiting for scanning. This is the consulting room.
Where you consult for
Yes,
pregnant
this is
women?
where, no, for OPD, outpatient.
Okay.
Generally, whoever is sick, he buys the card, he comes here, we consult him, send him for laboratory tests, and then do the necessary treatment.
Well done, sir.
This is a family planning unit. She's busy doing some activities inside. This is a scanning room.
Yeah.
The injection room. This is the dispensing room
For drugs.
for drugs. Dispensing room for drugs.
Thank you.
This way.
Yeah.
Being the primary healthcare, as the name connotes, you see, we deal with mostly diseases that affect children, malaria, typhoid, diarrhea, and sometimes too, we also do some routine immunization, but specifically, any disease that like these big diseases like hypertension, diabetes, these ones we refer them to secondary or tertiary institution. But diseases that mostly affect local communities here, mostly diarrhea, mostly malaria, typhoid fever, we handle them specifically here. And anything, we don't keep patient more than 48 hours here because it's a primary health care. Yes. They pay for the service, but the charges are minimal. You see, we are dealing with local community. And before of the poverty index we have in the country, you see, these places, if our services are cheaper than the tertiary or secondary institution. And that is why you see the rush, the influx of patients here. They pay for it, the little services, otherwise we will not also get the money to reimburse the drugs we issue out. Government is definitely involved because it monitors the activities of this facility. And in fact, sometimes they give us some drugs too, maybe for pregnant women and what have you. They come in from time to time to do some routine supervision to find out whether we are complying with the specified thing we are supposed to do. And you see, government is solely, in fact, it's government, otherwise we wouldn't have built this place. Because it was a program that was counter-funded by World Bank project, federal government and state government. So you see, they are definitely involved because it's a government property. So definitely you don't isolate government from it. They have to be involved seriously to monitor our activities, whether we are doing well or not.
The agency also offers mother and child care services, vaccination and immunization, as well as male-related health treatments. Health, they say, is life. And to live a healthy life, medical services is pivotal to achieving that vision. One of the major key focus of Governor Darius Ishaku is to ensure that all Tarabans, irrespective of gender, status, or religion have equal access to affordable healthcare 24/7 in Taraba State. Until next week, when I bring you more on the exploit of Governor Darius Ishaku, I'd like to say, keep discovering Taraba.